Hi everyone, thanks for joining me on drsue.ca. Well, I just got back from a fantastic conference at the American Obesity Society meeting in Orlando, Florida this past week, and there's so many things that went on there. It was just a fabulous meeting of obesity experts from around the world. I just wanted to give you a quick smattering of a few of the key highlights of the meeting. First of all, there was a real emphasis on the genetic causes of obesity, overweight, weight struggles. There are new genes that have been discovered to be associated with obesity in childhood, and a lot of the research now being done is looking at understanding how exactly these genes work. There's also some interesting research looking at food reward. There are differences in how each of us want food, and there's differences in how we respond to receiving food and enjoying food. And some of the differences in our perception of cravings and enjoyment of food may give us different baseline rates for obesity and for weight gain. In terms of management, with regards to lifestyle changes, there was an emphasis on the importance of restructuring our societies to be conducive to healthier eating and to have environments and communities that are more conducive to exercise, like having neighborhoods that are geared towards making it easier to walk and bicycle and so forth. In terms of medications, there's a lot of exciting new things on the horizon. There's nothing new that's available to us at this time, but things will probably come over the next couple of years. Looks like there's a progression towards looking at combination medications and combination therapy approaches, and a lot of discussion as well about what kind of information should be required in order to get medications approved, because there's been a lot of resistance and a lot of very slow-moving progress in terms of getting medications approved for the treatment of weight struggles. And then finally, with regards to bariatric surgery or weight loss surgery, the long-term results show quite a lot of variation in success depending on the type of surgery and many other factors as well. There's some neat new technologies being looked at, such as putting a liner into the lining of inside of the small intestine to inhibit absorption of nutrients for a period of time, and then removing the liner again, which is very, very early, but the results are interesting. And then with regards to type 2 diabetes and a focus of bariatric surgery in the appropriate patient who has type 2 diabetes, there is a very impressive remission rate of diabetes early on, but a substantial proportion of those people who initially go into remission from diabetes do seem to recur, and whether or when they recur depends on many factors, particularly the duration of diabetes prior to surgery. So that's just a smattering. I could go on for hours, but I'll stop there. Thanks again for tuning in at drsue.ca.